On behalf of the Transplant Manitoba Gift of Life program, we would like to thank you for your interest in being a living kidney donor. Deciding to donate a kidney is a big step. Over the next 15 minutes, you will hear some important information for living donors that we hope will help you make a decision that is right for you. You will hear about kidney failure and its treatment, the living donor testing process, the surgery, life with one kidney, and a bit about life for the recipient. Following this, there will be time for questions. At the end, you will be asked to complete a brief questionnaire to ensure that you understand what is involved in being a donor. Kidney failure. The kidneys perform 3 essential functions: filter out waste products and excrete them in the urine, balance minerals and water in the body, and secrete hormones and vitamins that are important in controlling blood pressure, making red blood cells, and maintaining healthy bones. Most of us are born with 2 kidneys. Normal kidney function is essential for good health. However, a person may develop kidney disease for a number of reasons. In many cases, kidney disease may result in a significant loss of kidney function or kidney failure. Once a person's kidney function is too low, often 5 to 10%, a person requires a kidney transplant or dialysis to keep them alive. There are 2 kinds of dialysis: peritoneal dialysis and hemodialysis. During peritoneal dialysis, fluid is placed in the abdomen for a period of time. The fluid is then removed, along with the waste products that the kidney would normally remove. This is done at home. During hemodialysis, blood is removed from a patient's vein and run through a dialysis machine, which cleans the blood. This is usually done in a dialysis unit, but may also be done at home. The other treatment for kidney failure is a kidney transplant. A kidney transplant is generally regarded as the best treatment for kidney failure. People who get a kidney transplant are likely to live longer than on dialysis and have a better quality of life. Due to the number of patients waiting for a kidney, the average patient will spend 4 to 6 years on dialysis before receiving a transplant. Transplanted kidneys can come from either a living or deceased donor. Deceased donors are individuals who have died, often from a stroke or accident, who agreed to donate their organs. The average deceased donor transplant will last 12 to 15 years. There are 2 major benefits of getting a kidney from a living donor. It means your recipient will get a transplant sooner and may receive a kidney before they need dialysis. As well, a living donor kidney will usually last longer and provide the recipient with a longer life than a deceased donor kidney. While living donation has significant benefits, it is important to understand that a living donor kidney transplant is not life-saving, meaning that the recipient will not die if you do not donate. There are other options, including dialysis or transplant from a deceased donor. Donor testing. Before donating, it is important that you undergo a series of tests to determine whether you are able to donate a kidney. This process is supervised by a living donor coordinator and a living donor nephrologist or kidney specialist. Other members of the team include a social worker, psychiatrist, and transplant surgeon. As a potential donor, you will be tested to see whether the recipient's immune system will accept your kidney, as well as to ensure that you have excellent kidney function and that your future risk of kidney disease is low. The testing will also confirm that your risk of surgery is low and that you do not have any diseases that you will pass on to the recipient. You have to be very healthy to donate a kidney. You must have 2 kidneys that work normally and no other serious health problems, such as diabetes or severe high blood pressure. Donors also should not be significantly overweight. Donors are often anxious to help their loved one as quickly as possible. It is important to understand, however, that your evaluation is an important process that may take several months to complete. It is also possible that you may be ruled out at any time due to an unknown condition. Fortunately, most donors are healthy. It's important to point out that if a new health problem is discovered during testing, This may make it difficult or impossible for you to get life or disability insurance in the future. The first stage of testing is usually immune testing. The immune system is the part of the body that protects against infections. The immune system will also react to and try to destroy anything foreign in our bodies, including a transplanted kidney. This is called rejection. Blood tests on the donor and the recipient help determine the risk of rejection and whether a transplant can be done. To determine the risk of rejection, we first check if your blood type is compatible with the recipient. Next, blood testing is done to determine your gene match or HLA match with the recipient. This involves checking 6 genes in their blood and your blood. Transplants can be done even if there is no HLA match, that is a 0 out of 6 match, but the transplant may last longer with a closer match. Lastly, a blood test is done to see whether the recipient's immune system has antibodies towards the donor. If this is the case, the risk of rejection is much higher, and direct donation may not be possible. If you are not able to donate directly to your recipient, the donor team may discuss the possibility of a paired exchange or kidney swap. This would allow you to donate to another person, and their incompatible donor would donate to your recipient. If the need arises, this will be discussed in more detail at a later time. The next stage of testing consists of blood and urine tests, testing for tuberculosis, X-rays, ultrasounds, a CAT scan, as well as other tests to confirm that you have 2 healthy kidneys and are healthy enough to undergo the surgery and live with 1 kidney. You will also meet with a social worker to discuss any financial concerns and a psychiatrist to talk about the donor and recipient relationship. One part of the evaluation is to ensure that you do not have any infections that you could pass on to the recipient at the time of transplant. These infections include HIV, hepatitis B and C, as well as others. In addition to answering questions about risky exposures such as blood transfusions, tattoos or piercings, IV drug use, and multiple sexual partners, we also ask you to notify the program of any possible exposures that occurred during the testing or prior to surgery. This is out of concern for the health of your recipient. If more than one person is interested in donating, everyone will first have immune testing done to see who is the best match. The Living Donor Program may identify one donor who is the best match. In many cases, no best match is found, and donors must decide amongst themselves who will proceed with further testing. Surgery. During the operation, called a donor nephrectomy, one of the donor's kidneys is removed and placed into the recipient. The left kidney is usually used since it has a longer artery and vein. The operation is done using a general anesthetic, meaning that you will be put to sleep and takes around 4 hours. There are 2 major types of surgery, either a laparoscopic nephrectomy or open nephrectomy. The surgeon will discuss the type of operation with you prior to surgery. Most donor surgeries can be done laparoscopically. Small tubes with either cameras or surgical instruments are inserted into the abdomen using 3 or 4 small holes. The surgeon performs most of the surgery through these small holes. At the very end, a larger incision is made in the lower abdomen to remove the kidney. Having a kidney removed is major surgery and has risks. The risk of death from surgery is around 1 in 3,000, or 0.03%. Other complications can occur, including bleeding, blood clots, infection, or hernias. In all, the risk of a complication is around 5%. Major surgery is painful, though everyone experiences pain differently. During the first day or 2, you will have either a pain pump or an epidural to treat the pain. Both work well, but neither will completely get rid of the pain. You will be encouraged to get moving as quickly as possible to minimize the risk of complications. Most people go home on the 2nd or 3rd day after surgery. Depending upon your occupation, You will likely need to be off work for 4 to 6 weeks. You will have a follow-up with the surgeon at about 6 weeks after surgery. It's recommended that you see your family physician every year for a blood pressure check as well as blood and urine tests of your kidney function. You may also choose to come to the transplant clinic for yearly follow-ups, though this is not meant to replace your family doctor. During the recovery period, you may need someone to help at home during the first few days. There is also the possibility of lost income during your time off work. The province of Manitoba and the Kidney Foundation have a program designed to reimburse living donors for expenses that occur after and in some cases prior to surgery. All expenses may not be covered, however. Prior to surgery, you will meet with the program's social worker to discuss this. Living with one kidney. Many long-term studies of living kidney donors have been done. In general, they show that living donors live as long as the general population. Donors are not at higher risk of kidney failure themselves. It is important to stress that many causes of kidney failure are unpredictable. The donor testing can test your kidneys now but cannot predict the future, and all donors have a small risk of kidney failure at some point in their life, just like people with 2 kidneys do. Right after the surgery, your total kidney function will drop to about half, since half of the filters have been removed. Over the next few months, the kidney that is left will filter more and bring your kidney function closer to normal, in most cases 70 to 90% of what it was prior to surgery. Donors do not need to take any long-term medication following surgery. The kidneys play an important part in controlling blood pressure. Studies suggest that living donors are at risk of developing high blood pressure earlier than non-donors. High blood pressure is a common condition that will occur in most people as they get older. It is a risk factor for heart attacks and strokes. If you have high blood pressure prior to donating, additional testing may be needed, and your doctor will discuss the risks with you. For women who may become pregnant after donating, the risk of serious high blood pressure during pregnancy is higher than in women with 2 kidneys, though the overall risk is still fairly small. Please do not hesitate to discuss this with the nephrologist if this is something that you have concerns about. Donors often ask what they can do to stay healthy after donation. There is no specific diet or other recommendations that apply only to donors. Generally speaking, the same healthy lifestyle recommendations that apply to the general population apply to donors. A healthy lifestyle includes a balanced diet, regular exercise, and avoiding smoking and excessive alcohol intake. This will help maintain a healthy weight, avoid diabetes, high blood pressure, and other risk factors for kidney disease. Lastly, a few words about the transplant recipient. The good news is that living donor kidney transplants are usually very successful. 1 year after surgery, 98 to 99% of kidneys are still working, and the average living donor kidney will last 20 years. This is just an average, and while some kidneys will last over 40 years, others will only last a few years. It is important for donors to understand that there are no guarantees. A kidney can be transplanted and never work. Fortunately, this is rare, but it is still a risk that all donors have to be prepared for. The recipient will also have to take anti-rejection medication for as long as they have the kidney. A few final considerations. The living donor team's job is not to turn you into a living kidney donor. Our mission is to provide you with the information you need to make the decision that is right for you and help you through this process if you decide to proceed. The evaluation process is completely confidential, and we will not share the results of your test with the recipient or anyone else without your permission. Rest assured that the reason that a person does not donate, be it a medical reason or other concerns, is also confidential. It's never too late for donors to have second thoughts or change their mind. This concludes our presentation. We hope that this information has been helpful to you. There will now be an opportunity to ask questions. Following this, you will be meeting with a nephrologist who will ask you some further health questions and give you the chance to ask further questions of your own. Once again, we would like to thank you for your interest in living donation.